So now we're coming closer to what brought all you here as women. Heart attack strikes differently for women versus men. While men typically suffer this chest pain radiating into the left arm, women suffer far more subtle symptoms that are often ignored or misdiagnosed until it's too late. In women, we often see stomach pain as a symptom of myocardial infarction, which is then likely treated with antacids or PPI drugs. Pain occurs in the arms, but also in the back, the neck, and even the jaw. Shortness of breath is equally present in men and women, same with nausea and lightheadedness. But sweating in women is often mistaken for hot flashes and ignored. And this is why women are 16% more likely to die after a heart attack compared to men. The symptoms are lesser known, connected to other issues, or quite often ignored by these women. They might say, I don't have time for this now. And in Canada, heart disease and stroke are still the #1 cause of premature death in women. Also interesting, just to give you a better understanding, 5 times more women die of heart disease compared to breast cancer. But only 1/3 of all the heart disease research focuses on women. All this data and statements comes from the Heart Research Institute and the Heart and Stroke Foundation, Canada. So, when it comes to risk factors for cardiovascular disease in women, there are 5 factors that apply equally to women and men. Number 1, diabetes. If not well controlled, diabetes practically turns the blood into ketchup. And you can imagine circulation is reduced if the blood gets more viscous. Number 2, high blood pressure is the biggest risk factor. With more pressure inside the pipe system, you'll get more deposits, more plaque. We would have the same issue within the pipe system of our houses if we run the system on higher pressure. High cholesterol levels have been a controversial topic for decades now. Today it's being discussed whether inflammatory tendencies or cholesterol inside the cardiovascular system are the underlying cause. This could be an evening-filling topic by itself, and I will go into it a bit more a little bit later. Smoking is a huge risk factor. Next to the effects on the lungs, nicotine tightens the blood vessels, so the pressure goes up. Finally, there's stress. And we're having a whole chapter on stress coming up in a minute. These were the common risk factors. And then there is the women-only section of risk factors. One of these is menopause, especially when women decide to use synthetic replacement therapy. There was a very important study in 1991 called the Women's Health Initiative, which was investigating the benefits of Premarin-Provera combination drug therapy, so-called HRT. And this study actually had to get stopped halfway through because it became very obvious that this specific combination of prescription drugs increased the risk of heart disease, stroke, blood clots, even breast cancer, and dementia significantly. But somehow these are still being prescribed today, not as much, but still. Even untreated menopause increased the risks indirectly because the hormonal changes during menopause can increase blood pressure, and estrogen withdrawal has a detrimental effect on cardiovascular function and metabolism. As a side note, there is the option of BHRT, or bioidentical hormone replacement therapy, where a knowledgeable MD, and meanwhile also naturopathic doctors, measure blood or salivary hormone levels first, determine what is individually needed for proper balance, prescribe bioidentical hormone preparations, usually compounded by a knowledgeable compounding pharmacist, followed by proper monitoring of blood levels in regular intervals. I've seen many run-down, gray-looking women turn into radiant, happy persons over the course of just 2 months. The other women-only risk factor comes from pregnancy complications. This is often completely overlooked. There's very clear statistic data from a Canadian study published in The Lancet in 2005. In this study, women with pregnancy complications faced an increased risk of premature heart disease. These risks increasing complications were low baby birth weight, with babies born in the low 10th percentile of the weight range, placental abruption, where the placenta separates from the uterus before giving birth, preeclampsia, which is characterized by very high blood pressure starting during childbirth, lasting usually for 72 hours, sometimes up to 6 weeks. And finally, premature deliveries and so-called gestational diabetes. Overall, 5 to 10% of Canadian women are affected by these pregnancy complications. And this concludes the women-only section of risk factors.